Hello, everyone, and welcome to today's webinar, Ransomware Preparedness for Healthcare, Enhancing Resilience Amid Growing Threats. I'm Steve Myers. I'm Managing Editor for Digital Health Insights, and we're very happy to partner with Healthcare Triangle to bring you this very timely and very informative webinar. A few notes before we begin. This webinar is and will be available on demand. We are recording it. So you will have a chance to look back on anything you thought you might have missed or want some more time with. And for those who missed a portion of it or were unable to join today, they'll be able to see the full webinar. So rest assured, this is available on demand after the conclusion of the webinar. Also, throughout the presentation, feel free and please do submit questions. For our speakers, you will see a Q&A function. We prefer you put your questions in there. That'll help us organize the questions, and we'll try to get to as many as we can towards the end of the presentation. The webinar is scheduled to run until the top of the hour. We'll do our best to squeeze in as many questions as we can. We will monitor the chat. You do have a chat function. We'll monitor that for questions, but we really would ask you to put them in the Q&A. So with those notes out of the way, let's get started. We have some wonderful speakers here today with just decades of knowledge in this area and some different perspectives. First, we have Lena Kannappan. He's the head of business strategy and partnerships with Healthcare Triangle. He leads and directs business operations and is the executive sponsor for strategic partnerships, mergers and acquisitions, and oversees some of the key alliances. And now you're probably all familiar with Lena. He's so well known especially for his work post-11. Here we are a day after that terrible anniversary, but all his work on identity following 9/11. But just a real quick, some quick background. He's been a serial entrepreneur for 25 years in the software industry. He's one of the original founders of SAML 2.0 protocol and federated identity management model for the industry while he was at Orange France Telecom. This changed the way identity information is shared between service providers and enabled the huge success of SaaS, cloud, and social networking. And again, you'll get to know these guys a little bit better throughout today's presentation, but I want to give you a quick couple notes on two special guests that we have here today with us. Dr. Dilip Nath is the AVP and Deputy CIO of SUNY Downstate Medical Center, where he leads a high-performing and responsive IT department while aligning technology initiatives with business objectives. Dilip has been driving IT solutions in healthcare for more than 25 years, providing leadership for continued development of a robust and secure environment as measured by successful ROIs, operational improvement, and organizational development. And we also have Chinna Subramaniam, who's Director of IAM and Directory Services for the City and County of San Francisco. He has designed the Identity and Access Management Roadmap for financial and healthcare applications and is a specialist in digital identity and transformation. And he has worked as a security architect in Big Four consulting firms, as well as large computer product technology companies. Again, we'll get to learn a lot more about these wonderful speakers as the presentation goes, but I would love to hand things over to Lena now to get us into a slide presentation, which will be followed by a panel discussion. Welcome, Lena.
Thank you, Steve, for that kind introduction. And welcome, I welcome everyone. Good morning, everyone. Good evening, wherever you are. So today's discussion is going to be very much focused on ransomware prevention and protection. And we're going to go through some of the mitigation strategies and cyber recovery plans that customers are looking at implementing. We also go through real scenarios and feedback from our special guest today. I'm really excited to have this chat conversation with both Dilip, who comes from SUNY New York Hospital, group of hospitals from New York, and also Chinna, who is from city of San Francisco, representing also various health systems who are working with the city of San Francisco. Just to give you probably a 20-second intro to who Healthcare Triangle is. Healthcare Triangle is an organization which focuses on helping health systems in terms of bringing outcomes, reducing costs, or in terms of patient outreach and patient engagement for hospitals. Also, Healthcare Triangle works with various pharma companies in helping them set up their next generation cloud infrastructure, as well as data platforms on the cloud, where security and compliance are the key aspects as they move their new initiatives to public cloud. We have many 100+ hospitals that we work with. We implement Epic and Meditech for hospitals, and also we are a trusted advisor in terms of with their digital transformation efforts. And cybersecurity is one of the areas that's really important for us and for health systems as well as life sciences companies as we bring out the solutions and services for these organizations. I'll just go through the agenda for today's discussions before we get on to the panel discussion. I will be talking about the ransomware challenges in healthcare today, and then also go over a few metrics where the effectiveness of ransomware response program perspective, and then get into the prevention and protection solution for ransomware. And what is government doing about this issue? There's a lot of talks and things happening in the industry, especially in the last few months. It's really important that we have an opportunity to discuss and bring out real value for customers, for them to take their strategic whether it's operational issue or whether it's really they want to mitigate, depending on where they are on this cybersecurity journey. And finally, I will have Chinna, who is an identity management expert, to come and talk about the strategy. So here are 3 important learning points from this webinar you will gain from. So we'll be talking about the incident response planning, and what are the security testing, whether it's continuous testing or whether emulation testing that you need to do if you're a health system, and also the individuals who are involved, and in terms of reducing ransomware impact and enhancing the cybersecurity hygiene in healthcare. It goes beyond just the responsibility of the CIO or CISO. The entire leadership team needs to get involved in whenever such an incident happens. And I think here today we will be talking about how do you prepare for such attacks, and how do you prevent to mitigate such risks, and also go through the ways to how do you rapidly detect these attacks onto your systems, as well as how do you quickly respond to this and then recover. So rapid response and early detection is really critical in terms of ransomware attacks. So one of the fundamental things, especially for the audience here, what does ransomware really mean? It's a type of a malicious software designed to block access to a computer system, where the bad guys, demand money. In fact, in terms of bitcoins, until you pay the money, they don't decrypt these systems or applications and allow the access back to the healthcare constituents in terms of how you are affected. And one important thing is the law and enforcement cybersecurity firms have to be informed way in advance. We expect the leadership from the health systems to be in touch with whether it's FBI or regulators. You don't have to wait for the incidents to occur. So the ransomware attack is, many rural hospitals and small hospitals, still there's not enough cyber awareness. I think this webinar and this discussion is really important for such folks to have the initial awareness and education program internally, and then prepare themselves, get ready to mitigate and respond to these attacks in advance. So what are the real challenges? So the number one thing, the significant challenges that ransomware pose to healthcare organizations is the disruption of the entire operations within the health system. And the patient care is disrupted once the critical systems become unavailable. And the second point is there is a major risk to patient safety, because once you don't have right access to the patient records, that could lead to either misdiagnosis or incorrect treatment or all other safety issues within a healthcare environment. The other important aspect is the financial aspect. As we all know, once your systems are locked, your entire operations come to a standstill, and there are hospitals who are they end up closing down the entire operations, and they even go completely. The downtime may go even beyond a month in terms of for the hospital to come back to normal. The another bigger issue is the regulatory non-compliance. As we don't have, when you don't have access to patient records, and when you're not compliant, you will be penalized by the, with the regulatory fines, and then you may not be able to, comply with the HIPAA sort of regulations. And then the next big challenge is the reputation damage. Once the hospital runs into such a ransomware incident, then there is a big loss of trust among patients and other partners within that ecosystem. And eventually, there is a huge, reputation damage in front of the public. And finally, there is a difficulty in prevention and detection. As these attacks are constantly evolving, and even people are talking about ransomware as a service. And some of these ransomware groups who have a number one target is health systems and patient records, they even share the techniques and tools between those groups. So it's a constantly evolving trend, and it's a major challenge for all the hospitals and the health systems. So I'll quote a couple of, there are many incidents happening. If you look at the CommonSpirit one, which is the biggest one, there was the ransomware attack had led to 150 million in losses till date. Over 140 hospitals were impacted during the time, and 600,000 patient records were breached. But this happened almost a couple of years ago. The entire system had to be shut down, and so many hospitals within their network had to be shut down. And this continued with many other hospitals of different sizes, whether it's West Coast or East Coast, or any part of the US, and primarily the healthcare systems in North America are the major target for these ransomware guys. So if we talk about the recent attacks, HCA Healthcare, as you all must have read in the news, out of those 170, 180 hospitals, 12 hospitals were impacted and 11 million records were breached. And IBM came up with there's a recent report talking about the cost per data breach has gone up to almost $5 million. And also there is over $7 billion worth of downtime losses for hospitals. In 2022, FBI reported the number one segment was attacked for ransomware was healthcare. So it is a and also the recent MoveIt software based ransomware attack happened that not only impacted university health systems, also there were few banks and many employers, including CalPERS from state of California. There are multiple different organizations. The attack happened in on a chain basis. So it is not just a single hospital when this incident happens. If this happens through a third-party vendor, then it actually spreads across multiple health systems. So as I mentioned earlier, this is an evolving trend now, and there is a rising cost. And the targeted attacks, start from phishing emails to gain access to networks. And there's a concept called double extortion. The double extortion really means not only the bad guys encrypt this data, systems, applications, everything goes on your network. They also, once they have access to the patient records data, they actually try to sell it on dark web and they try to charge it again. So there is a double ransom payment the health systems end up making. This is becoming increasingly common in healthcare now, quoting several incidents in the last months. And there was an Illinois hospital, after a couple of years after ransomware attack, they finally end up shutting down the entire hospital. So this is a pretty serious issue. So I just want to take a couple of seconds here. There is multiple metrics that really help to measure where you are with respect to preparedness, your detection capabilities and response efforts. The mean time to detect is how fast an organization can detect ransomware. And if your MTD means better detection and quicker response. And everybody, who's in healthcare will understand RTOs and RPOs. The recovery time objective is how fast you can recover your data or applications from your backup disaster recovery, whether it's in a data center, whether it's on a public cloud or your private cloud environment. And it's all about minimizing downtime. And the recovery point objective is how much data leakage you have, you recognize when during the recovery. So you want to have a minimum leakage, and how do you measure this metric? It's the desired, you want to have a desired restoration point after incidents happen. Yeah, so I think from healthcare Triangle, we've been talking to several CXOs of many health systems, especially in the last couple of months. And one thing is very clear: this is not a one-time thing that you can solve. It is a journey. It is an end-to-end a challenge for the health system CXOs. So the best proposition recommendation we give to CXOs is, see where you are on the journey. We go and educate and assess, do continuous assessment of your infrastructure, and have best practices and guidelines before you start on this journey in mitigating and preventing and preparing yourself. And also do tabletop exercises that will help because it goes beyond a CISO in an organization within the leadership team. Everybody should be aware. And how do you prepare a backup DR, moving your applications and data, whatever feels sensitive? I think that has to be put on you have to have a backup DR. and have a proper data archival, and have continuous security penetration testing of your existing systems infrastructure as well as your backup DR systems. And then identify your vulnerabilities, whether it's in systems or applications, and have tools or means to check your vulnerabilities as well as threat factors, inbound as well as outbound challenges that you should start thinking about and start mitigating such risks. Once you do that, you plan to prevent and protect. The protection may mean identity protection, data protection, device protection, or network protection. It's important that depending on the appetite and the budget you have allocated to your organization, do these in a step-by-step manner. It's not just the MFA is going to solve the entire problem for you. So there has been a mandate to, you start with MFA, but you need to get into identity access and governance. I think this is where our speaker, panelist, China, will go into a little bit more detail. And then how fast you detect. The moment you detect, you try to move to disaster recovery DR systems with a minimal R2 and RPO, and also see how quickly you can respond. You can use on-prem tools or public cloud if you are already trying some application or data workloads running on the cloud. The recommendation is not just choose one vendor, choose the right vendor for the right stage of your program. I think in your preparation and the entire journey, when you write your incident response plan or cyber recovery plan, call out these in stages. And finally, you find the best ways to recover and heal from your data loss. I think it's the educate, assessment, preparation, identification is really critical before you get into a prevention and protection mode. With that, I think I won't take much time. Just pass it on to. I will invite the director of IAM and security at City of San Francisco, Chinna, to spend a couple of minutes to discuss IAM, and then we will go into the panel discussion.
So IAM is actually it's a IAM layer of protection for healthcare is very important. I actually wanted to quickly go through this. So the main important thing is in any organizations in healthcare sector or any sector, right? Getting the policy in place, right? That is actually going to be the first win. So please discuss with your business stakeholders and educate them how important it is. And then from Office of Cybersecurity, you actually come up with a cybersecurity policy and standards for your organization. That is very important. Once you actually succeed there and you are able to educate, that is actually going to be a big win. And then the rest of them is going to be easy. So establish actually very good security policy for your internal system, your external system, how actually they're accessing from outside vendors and other people, third party and other health providers. And you have to have a very good life cycle for employees, contractors, and whoever is working as a person of interest from other hospitals. They will come and work. So make sure actually the life cycle is defined. So and also you have actually the endpoint security policy. All the devices, whatever is connected to healthcare system is properly the patched, and then the risk scores are actually identified, and then actually also establish what kind of IAM policy, authentication policy, your authorization policy, and then the privileged access management system policy, everything in cybersecurity policy. So I'm talking about identity governance, right? So you'll have a HRMS systems for any companies in the healthcare system, and you'll have a medical credential system which stores national provider ID and medical credentials. And you will have actually healthcare application like Epic, Meditech, or any other applications, right? So the first thing is actually we have to integrate all this application to unique identity. That is the actually very basic thing we have to do it in IAM in healthcare industry, which will remove all the duplicate accounts, and then you will not be actually the two perspective, right? You are better protected at the same time. Actually, you are reducing a lot of cost in licensing, and automate the provisioning and deprovisioning. If somebody joins as a healthcare professional, you actually onboard them automatically in a real time provision to the healthcare applications and all other applications. And if somebody actually move to different department, and then you actually reprovision their roles and have actually segregation of duties, right? That is very important. And you have actually proper workflow approval. If somebody wanted to actually access particular resources, and then you have to have approval, single level approval or two level approvals, and try to have a practice of access reviews. Try to review your team of what access they have, whether it's really required or not. That is very much is required. Yeah, next slide, Steve. So here, actually, this slide, I'm going to talk about access management. So onboard all your healthcare web-based applications integrated with your centralized IAM system, whatever you're using today, make SSO, and enforce actually strong multi-factor authentication. So there are multiple multi-factor authentications there. I would recommend actually follow 502 or TOTP, or even actually implement privileged access management to access your servers. You will have a lot of internal servers, which is very critical. And many organizations actually they have implemented PAM solution, but still a lot of organizations they're still actually having the root password, sysadmin password, database people passwords they will share among with them, and then they tell that actually don't tell anybody. Actually it's we have to share and then work. That is the only way. Yeah, don't do that anymore. The best way to protect all your privileged access management accounts, actually implement the PAM solution. And also in a PAM, you can do actually just-in-time provisioning. You no need to actually give a very highly privileged access all 24/7, right? You no need to do that actually. During change windows, just give a time-based access only Friday evening 6 to 8 p.m. China will be actually doing this deployment and needs actually access to this many servers, and only actually provide that access, and then automatically the access will be actually cut off at 8 o'clock. Or you can extend it if something goes actually more than that, right? And also actually it's important actually you have to educate to your team surveillance, actually put a recording on your access what they're doing into the privileged sessions and accessing servers, applying patches, deployments, all those things within our team, to make sure actually there is no inside threats or anything. And also to make sure actually enable passwordless, which will avoid actually having complex passwords and every time 90 days to rotate the passwords, and they will actually write down somewhere. It's very interesting to actually make it passwordless. Is very working. It's not actually, it's a concept, it's working actually passwordless and passkey, all those things are good. So the other thing is actually the other important is cyber defense platform, right? You have to have a lot of tools, whatever actually it works for your organization, you discuss with vendors, and then for your use cases actually get. So all your external calls actually come through web application firewall, where actually you can avoid DDoS attacks or other throttling. You can put a through email security tools, and you can have a SIM tools and the endpoint security, and endpoint security, make sure that patching is actually up to date. If something is not patched, then that has to be actually alert to everybody, this is patched, and then this system, whatever the request is coming from this particular IP range, and or whatever the servers or something, actually we can deny based on the patch score. And then you can have actually very good network protection tools, and then a DNG protection. So as this is not actually traditionally we focus only external connectivity. Nowadays there is no external, internal. You have to have a firewall everywhere, and you have to protect your system. Yeah, quickly I'm going to actually go through this API gateway. So try to have an API gateway, expose all your APIs to the internet actually through API gateway. Whatever actually they're trying to access from internet, to pull some information to share with other hospitals or back and forth. Don't directly give access to their APIs. That is the biggest breach entry point. So API gateway is actually you can apply rate limit, and you can actually API gateway take care of actually DDoS attack, and then throttling. Everything can be addressed there. Just look into this avenue, and try to have a highly resilient systems. I think Lena explained all the how to actually have a backup DR, how to have. So the highly resilient actually you can have actually on-premise and then cloud both together, or you can have a multi-cloud resilient systems. It's up to your business and then your company, and have actually dedicated pipelines from your network to cloud data centers. And for redundancy, sometimes actually the fast connect or who the vendor, it's not working, they have outages, have a VPN tunnel between your company network to cloud. So that will actually in a matter of minute you can able to bring up the systems. And artificial intelligence, right? You look into actually artificial intelligence AI side in every layer of IAM actually protect your systems actually intelligently. What is the user behavior suspicious, how the user trends, right? Access reviews and workflow everywhere you can apply AI is actually for your use cases. Try to find a use case. So AI is no more hype; it's actually real. Everyone have to actually have a AI skill sets and everything. So it's better to actually think ahead instead of missing it now. And also, you can actually implement in AI. The important thing is a conversational chatbot you can develop for healthcare system, and that will address all your help desk issues and everything. Apply generative AI there, not only based on documents or data sources, but always actually it will be able to think smartly and then answer from other sources as well. That's why generative AI is going to help there.
Thank you. Thank you, Steve. Thank you, Chinna, for that in-depth discussion around identity management, access management strategy. So let me open this for panel discussion. Thank you, Dilip, for joining us. I would like to learn first about what's your role within SUNY as the AVP and Deputy CIO of a network of hospitals. If you can give us some background about what you do on a daily basis to the audience, that'll be helpful. Then we'll go into the questions.
Well, thank you, Lena and Chenan, for the beautiful presentation. As Lena said, my name is Dilip Nath. I'm the AVP and Deputy CIO at SUNY Downstate Medical Center. It's an academic medical center. We are in an urban setting, and as my role as a technology leader, really, keep the shop running. That is the most important job of my everyday. Make sure that everything is running, and also put forward the strategy so that we can continue the innovation and new things going at the organization, and still be able to protect and prevent and do the things that we do for our patient, for our student, and for our community.
Yeah, that's great. I think you're doing a great job there. Let me start off with some basic question. First, have you ever experienced ransomware or any sort of a cyber attack situation at the current job or even your prior job? And if yes, what are the key learnings that you heard? And would that what you faced is a life-threatening situation? Can you give us some idea?
Yeah, thank you for the question. It's a great question. Look, thank God I have not, we have not got directly affected, but I have witnessed friends and colleagues who gone through this extraordinary challenge by, getting hit by ransomware. It is not fun. One thing is for sure, devils never sleep. They're continuously wanted to hurt organizations like healthcare, finance, and other. One of the key things that ransomware is just not simply an intrusion or interrupting a network service. It is really a cyber criminal. They are terrorists, cyber terrorists. They want to disrupt our way of life, and this is that serious. And to combat these cyber terrorists, ransomware, you need to have a well thought out plan to combat this when this happen. Hope it doesn't happen to anybody, but reality is it's been happening, right? Now your question is, what are the learning and what can you really do to some of these things? Well, look, fundamentally, if this ever happened to anyone, the first and foremost thing, you really isolate the infected system so that you prevent further penetrating in your network. That is the first and foremost thing. And then, of course, the next thing, you collaborate with your law enforcement because they have been dealing with these things for many more than one organization, right? They have the experience. They can aid, they can bring the expert knowledge to help you in those situations. It is important and critically important to collaborate with them. And the other thing is really effective communication with your stakeholder, with your customer, because this is key. People trust us to provide a care, right? So we need to make sure that we are transparent with our patient, providing the information. How quickly can we get back and running? What are the things that we are doing? What are the plan and mitigation plan? And also do it with such a confidence, and we will get back. We are going to keep going and running, and they will and be able to continue to provide the patient care. I think that is really the important key element, if you will.
I think you hit a nail on the head. Continue to provide the best care for the patients. How do you make it happen? So the thing is, I think in terms of the ransomware attacks, what are the immediate measures that one health system would take? And there are also partners in the ecosystem. There's always a recent things I hear. The chain of attacks is one thing. Whether it's a Microsoft Outlook keys were compromised, and then that actually percolated across different systems. Then also the MOVEit attack was pretty dangerous, right? What are the critical areas of measures that any health system should put in place?
So there is really no silver bullet for this, preparing and protecting. But there are a few fundamental things that we all, as an organization can continue thrive on those. One of them is really through a complete risk assessment of your critical component in the organization, and plan out, what are some of the weakest link you might have, right? Identify system flaws and analyze them, and really how it can danger the other associated system if something get break into those systems. And then really the organization, as an organization, you need to really build out a plan for delivering successful mitigation measure, by appropriately identifying those potential vulnerability. If you don't know what you have, if you don't know what is your weakest link, and then you are up for grab. That's really what it's boiled down to.
Yeah, absolutely. I totally agree. I think specifically, do you have any recommendations for the data protection and data recovery? I always run into a bunch of vendors. Almost everybody who is in security space, they claim they're good at data protection, data recovery. So what's your perspective on this, and what should the health system leadership should what is the best practices from your experience?
Well, the first and foremost, having a reliable data backup is the first recovery mode, right? If you don't have a good backup, you can never recover and extend, organization and be able to provide the service that you need. So, there are obviously many organizations, we do backup, traditional backup, right? But I think we got to go beyond that, right? So that when I say beyond that, something immutable backup, air gap backup, right? There are there are solutions out there who provide such a backup, so that it's like you're bold, you're safe, right? So that if a ransomware get hit your backup, of course it's going to penetrate to all of your daily, weekly, monthly backup, but you still safeguard the data with an air gap solution, so that at least you can restore the data from that air gap solution and keep the organization going, so you don't have to fall into the attacker, basically.
Yeah, just to extend on that, people say prevention is the cure, right? So what are the prevention strategies that you have followed or you're following, or even your peers and colleagues? I'm always keen to hear from the New York State. I've heard few incidents happening even in Staten Island and others. There's one of the hospitals here was ended up paying more than $1 million for ransom. So I think prevention is really important. So what's your thought on prevention?
Look, the reality is, I'm a fundamental believer that we should never encourage paying any of these attacks. If they are simply and terrorists, we do not negotiate with the terrorists. You combat and you fight. But the key is, when you want to combat and fight, we need to make sure we have the data in a safeguard, right? But there are a number of things that an organization can do. One of them is really a rigorous risk assessment. That is the key, that will identify the vulnerability, right? And threats. And then effective response planning. If something to happen, what are we going to do? How, do we have a plan to address that? And other thing is employee education. You cannot go wrong. You cannot overstate. It is everyday learning. It's not something you train the employee on the day of the onboarding and then forget about next 5 years. No, it has to be continuous employee education. And then other thing is strong security infrastructure. Oftentimes we do not, see the value of it, but you know what? It is the cost of doing business. We have to invest in security infrastructure. There is really no way out. And then having a patient-centric approach is key. Maintain the patient trust, resolving their concern, data security, and crucial in the healthcare sector. And then idea is you build the security framework, you build infrastructure, you build all the security wall, but you know what? You have to continuously improve on it, because no wall is good forever.
Yeah, absolutely. I agree. I'll come back to you on the cyber insurance conversation. So Chinna, there was a pretty good insights you gave from identity management perspective. Identity protection is really key, and also identity attributes recovery. So what is your role today? I think I understand you represent city and county of San Francisco in terms of IAM and security initiatives and implementing things for various sub agencies. You also work with university health systems, right, within state of California.
So we work actually closely with the UCSF and some other state agencies as well. Yeah.
And I know state of California, there is multiple agencies got hit recently, and also I used to hear about Harvard, and even in fact the UCSF went through this challenge in the last couple of years. So what are the things specifically I want to ask you about from an identity perspective and prevention and protection together? What's your thought on what should the best practices that the audience here, as well as the health system, should follow, adopt from your experience?
Yeah, so the health systems, the best in IAM perspective, we wanted actually the identity actually governance. So we have to eliminate all the duplicate identities. Actually, if you see who is accessing the healthcare system, they will have actually multiple identities. So how to address all those multiple identities? Actually, I have talked about that briefly. So healthcare system is a medical credential system, and they have healthcare applications like Epic, Meditech, Cerner, and other right. How to actually integrate all these identities as a single identities, right? So in that way, once you actually make this identity governance piece automated and actually it's flowing from HR system to your medical credential system provisioning, and then from there it is coming to IAM, centralized IAM system, where we can able to provision based on your trainings. Like, you can actually connect, reconcile all your trainings, actually, like, whatever actually the healthcare professional mandatory trainings, we actually like, make sure that mandatory trainings are completed. Then you can actually provision employee templates and cert templates to actually healthcare professional. So this is actually first important thing. The second, actually, once you have complete this automated identity governance side, provisioning and deprovisioning, jump into the web applications. There are a lot of web-based applications in healthcare applications, right? Integrated all of them with your centralized access management system, and then make sure that all those applications access with the strongest multi-factor authentication. So in healthcare today, in the city and county of San Francisco, we face a lot of buildings does not have actually the Wi-Fi receptions, and then they may not actually have actually able to access when you are treating patients in a prison, right? In a city prisons, actually they will not get. So how will you ensure that the MFA is working there? So you have to use strongest MFA in those as well, right? So that is a very important area in a healthcare. And then the continuous assessment, actually you have to keep hardening your system, right? Hardening, actually, there are a lot of third-party tools, within actually whatever the product we have actually buy and use, there are a lot of availability. You have to actually go and spend time with the vendor and find out actually for this license actually what is my tool, on-demand tool is available, and you harden your system. And everywhere, actually, from your Active Directory system to your healthcare system, harden and patch, and then don't delay it. And then also awareness, you send a monthly kind of office of cybersecurity newsletter to everybody and educate them. And then that's all actually I'm thinking.
Yeah. No, identity is really key for this entire, this is an entry point for the bad guys, right? They, whether they impersonate identity information or the credentials, or they steal these credentials, or they, through phishing, they get into these networks. I think, and if MFA is broken or breached, people say your systems become like marshmallow. So these bad guys can just get in and do, lock your application systems and everything. So is there a specific strategy that go beyond MFA? That's what when you mention identity governance, it goes beyond MFA, right?
Yeah, it's actually, so I cannot say that actually MFA protects everything, right? Your system is protected when you enable actually strongest and factor. So you have actually multiple layers, right? So we discussed about you have to have actually first user request, that is MFA authentication, and then MFA and proper authorization, everything, right? Access reviews and workflow. Then you have to have a web application firewall to actually from where it is coming, right? And enable captcha or something to avoid bot attacks, right? And then you have to have a API gateway, right? You're not actually allowing everybody from internet actually try to fetch your medical EHR information and then passing to some other hospital, sharing between, right? You implement a API gateway. So we have multiple, and you have actually a lot of firewalls, internal firewalls, external firewalls, and then a lot of networking tools. So we are not only depending on the IAM MFA, we are also actually integrating with the endpoint security, right? So we use actually endpoint security tools today. That tools will go and actually make sure all city issued devices actually patched properly. If it is not patched, we generate a score. So based on that score, actually IAM system will react. Hey, this system is score is actually below, then that means that is actually I cannot give you an access, right? So this is actually within, but something is coming from internet, you send it through API gateway. And then also we discussed about privileged access management system, right? That is very important when you're trying to access your healthcare applications backend systems for patching or if you take actually any company, there will be a system of administrators and application administrators, how to actually protect them, right? So you have to have a PAM module as well there.
Yeah.
So you have to have multiple layers.
Yeah, no, excellent points, and I really appreciate those tips. They're directly valuable to the audience. So let me switch back to Dilip. From a CXO's perspective, is this ransomware, is a board level conversation today? That's my first question. Second question, how important is to have a proper cyber insurance in place?
Look, first of all, it is a C-suite level discussion. It is, as you have mentioned earlier, their organization has gone out of business because of the ransomware attack, right? And this conversation cannot just stay within the IT. It needs to elevate to the president and CEO level. And that is a given. And it needs to be continuously update what is happening in the market space, and also the threat vulnerability that you are seeing within your organization. And the other thing is, look, one of the things is many of the healthcare organizations over the years, we have accumulated technical debt. Clinical system is sometimes hard to upgrade and keep up with the phase of the other technology changing, right? And require heavy investment. So keeping up to date and having an open and transparent conversation with the C-suite and elevate this urgency and importance of this is critically important. Another thing is, look, cybersecurity you must have. I know getting insurance is not an easy, because nobody wants to buy the insurance when you don't have a good first level of prevention in place. It could be expensive proposition, but it's something good to have, something that you can lean on when you need it, right? Again, it's the cost of doing business.
Yeah, no, absolutely. So what's your perspective on the same point, China? Because I also see, from audience, someone has a comment about cyber insurance, but go ahead, China.
Yeah, so insurance is actually worth something happened, actually cyber attack, and then how to bring back the system remediations, right, and recovery. So there are two part of actually cyber insurance, right? It's a first level protection and then third party protection. So we have to be actually thoroughly know what to agree on the terms, and then how to actually purchase cyber insurance. But it's very actually important for healthcare sector, and it's covered. Actually you can take minimum actually for occurrence, actually they are selling actually per occurrence how much they can able to cover. But we have to actually detailed enough to understand all the coverages, make sure that that is working. If something happened for ransomware, for your financial loss, okay, how much they can cover, right? If, for example, some third party vendor or buyer or somebody is actually suing actually you, hey, you allowed actually to make this ransomware in fact happened, and then that time actually how that actually we can able to pay the claim to the third party, right? So these both aspects are there. But it's very much required actually don't think that insurance is actually not going to help, and then it's just there taking the money every month as a premium, but don't think in that way.
Thanks, Chana. This has been a fantastic lively discussion here. This is all not prepared. So let me go back and Dilip, on your final thoughts. In your final thoughts, can you also include a comment or your view on generative AI? What is the impact of Gen AI coming into healthcare? What are the issues and risks that healthcare community is going to face if you don't have proper model risk management, model evaluation in place for these AI stuff? But also, please give your final thoughts on the message for the audience.
Sure. Look, technologies such as generative AI and the data modernization have immense potential. It is critical that cybersecurity is not jeopardized in the process. The idea is, how do you balance innovation and security, right? We need to protect our infrastructure. We need to protect our data. At the same time, we need to continuously evolve and innovate and usher the AI. AI is here, and I am fairly confident, if not 100%, but it is going to change the way we do business today. And also, I think with the right approach, with the right innovation, with the right integration, I think AI can, detect many of the early early detection that we oftentimes fail to do as a human being. Look, finally, this is a rather serious subject, right, that we are dealing with, ransomware. Again, like I said, this is an active terrorist who wants to attack our way of life. And this needs to be dealt seriously. As an organization alone, it cannot be dealt. I think government has a lot of role in there, right? Because only together this can be mitigated and this can be combated. Obviously, organization alone does not have enough technical or knowledge expert residently. There are partner out there who also can help with this. One of the things that I have learned from a colleague, when something like this happen, right? You're really running your business from a Rolodex, right? You have hundreds of vendors, right? But who do you really call the first who can really bring all the right resource to help you on the situation that you are facing? So having a right vendor partner is critically important in overcoming the challenge. And again, thank you for including me in this conversation. I've learned a lot of great things from this, and I'm sure we're going to continue on this journey for many more.
Yeah, absolutely. Yeah, thank you for that. I think you mentioned about government. I think the federal government has taken important initiatives. They have established a ransomware task force. That's one thing. They also have an website that's open for everybody to go and provide latest information or any alerts, and all of the information they can share with the public. And secondly, there is recently a Cybersecurity Act a bill was passed to create cyber awareness programs among all rural hospitals. I mean, they are the most vulnerable in this country. And with that, I think I transition to Chinna for your final thoughts as you work for the city, and also you are affiliated with the state of California government perspective. So please go ahead, Chinna.
Yeah, sure. Thank you, Lena. So my final thoughts, harden your systems, keep hardening your systems, run your pen testings, and don't actually keep it for like every 3 months or 2 months. Actually, build some AI system. That's where actually it's going to help you. It will you can have actually on-demand system. So have your artificial intelligence, right? It's not going to replace humans. Actually, it cannot actually maybe match human creative thinking, but the AI is actually need, and it's going to be everywhere in every sector. Actually, if you see from another 5 years, any actually job openings, they will ask actually minimum experience in Gen AI, and then so try to actually define a use case. Don't jump into AI. It's actually try to define what we can actually from start from basic, right, and then build from there. All this AI is actually going to help, and then actually you build your vector database. You actually chunk your data, and then actually keep all those mapping in a vector database. Don't actually send all sim logs to actually OpenAI or some other large language models. That is going to be expensive. So whatever the actually it's a content based, or it is going to be a lot of useful in healthcare. Actually you can put all the contents actually in front of AI, but make it chunk and then map it in vector database, and then write your own language models actually using whatever the open source Llama or Llama 2, and then actually you send it to large language models, actually OpenAI or other AIs. Then you will get actually very useful 99% answers. And then also you can apply generative AI on top of that. That will actually not only limit it will create based on the data learning, right? Your model, it will create its own the solution and everything whenever actually interacting. And other thing is actually as I mentioned, a cybersecurity policy and standard is very important for every organization. If you're able to succeed, define your cybersecurity policy and standard for any organization, and educate its stakeholder and sign off. Okay, this is the policy and standards from actually IAM policy or network policy, or whatever actually, right? The API policy, everything, right? Once it is in place, it's very easy for you to actually make sure actually like any new things coming, everything it's already protected. We are starting from actually we are not allowing anybody to hack the system. You are actually like the while deploying itself, you are securely deploying the solution. So that's where actually cybersecurity policy and standard is going to help. So yeah, it's access management and identity governance. Try to eliminate all your duplicates and try to save money there, and then keep hardening your systems.
Yeah. Thank you. Thank you for those final thoughts, Chinna. And this has been a really interesting conversation. I think this dialogue will continue, right, with more, and we would like to bring on more CXOs and learn from them, as well as any tips and we can get from them is good for the audience. And we are looking forward to collaborate with many health systems in this journey. And wherever possible, we'll also try to reach out to the right government authorities or state local agencies in this dialogue. And prevention and protection is really important, especially as we are all facing a major ransomware challenges, and it's evolving. It's important that we all come together as a community to tackle this issue, this important issue for healthcare data, patient records, and health systems. And thanks again. I think we'll open it quickly for Q&A. I see there is one question, comment, just specifically on cyber insurance. Then there are a couple of other questions here. So there's a gentleman, Rick Labe, is making a comment. Cyber insurance is worthless anymore. They rarely ever pay a claim. What do you think, Dilip?
Look, if you look at the requirement of the insurance, getting a cyber insurance, they send you a list of questionnaires you have to fill out, right? I mean, at the time you have checked, okay, I have all of these, but year later, things change, technology change. So, it's just difficult. I mean, I can understand from the insurer point of view, but from the provider point of view, us, we always think that we have something safety net in place, but that might not be the case, right? There is no guarantee that any of these insurance premium, really going to come through when you need them. I mean, I hear some of the worst story, but I hope that is going to be formalized and sort of regulate better when it comes to cyber insurance. I mean, there is no boundary to this thing. Generally, if you get a liability insurance for your car, ABC, you get pay for it. When cyber insurance is wide open, right? What do you get covered for? Because an employee click on a bad phishing email that invite the virus. I mean, okay, now you employee fault, right? So it is really no winning on here.
Yeah. No, I think that makes a lot of sense. But 4 or 5 years ago, nobody was talking about cyber insurance or insurance specific to identity theft and all that. But at least now, the industry is moving in the right direction. I know, Steve, you want to see a couple of questions?
Yes, hello. Yeah, we have a couple of questions. We'd love to get in a couple of questions before we wrap things up. Let's go to the first one. Obviously the title is ransomware, and health systems and hospitals are facing these ransom requests. And we heard from Dr. Dilip, and we hear routinely, don't pay the ransom, but then it happens. They pay the ransom. What would compel you to negotiate and pay a ransom? What's making people pay ransom?
Well, first and foremost, look, here is the thing. If you pay the terrorists, right, they're going to continue, they will come back and attack you again, right? So how many times you're going to pay them, right? The idea is to work with the law enforcement, work with your, government agency to combat that. But again, you can combat that and not pay the this attacker if you have a good backup, if you have an air gap backup where you can prevent you have to preserve your data so you can run on a different instance and get the organization going. If you don't have a good backup, then obviously, and also there is no guarantee that even if you pay, they're going to get to release the key and you can recover all the data. So there are also, incidents like those.
And the law enforcement, I mean, the federal folks can actually fine you if you're a CEO or CFO releases the money to these bad guys. So it is important that as early as possible, you should reach out to regulators and FBI rather than trying to take care of this by yourself. I think that's the message you are giving, right? Dilip?
Yeah. Mm-hmm.
Yeah. Go ahead, Steve.
Sounds good. It makes sense then that preparation means a lot, and maybe those paying ransoms weren't as prepared as they should have been. Let's get in one more here. Why is it so hard to find a single solution to cover ransomware strategy?
You know what? That is my dream and hope that one day we have just one silver bullet solution where we just buy that and it's just going to protect everything that we have. And I don't think we'll ever be there, right? But the idea is you work with some of the expert in the industry and actually have a sort of list. Okay, here is my ransomware guru or ransomware strategic partner, right? And you're going to have a continuous dialogue. What is your risk look like? What are you doing? And if God forbid something happen, who do you call first to help you on those situations? Because when this kind of situation you get into, oftentimes you're struggling with so many things, but you need a third set of eye to look at the situation and guide you and walk you through to mitigate those challenges.
Yeah. Well, thanks, Dilip. Any quick thought, Chinna, or we move on to the next?
Yeah, so it's as mentioned, right? It's actually cybersecurity has multiple domains. It's in every domain as actually network security, IAM, and then right cyber assurance. So that's why actually we are not able to get a single product. So every layer, it is actually wherever it's a weakness, they will try to find and then hack and get into the ransomware. That's why actually, it's very difficult to actually one vendor is saying that I can able to protect for your company with a single.
Yeah, sure. Yeah, there are a couple of questions.
And one more thing, for cyber insurance, someone was asking actually how to write. So my suggestion is once you get a cyber insurance, you review with attorneys, your company attorneys. So, okay, so this is the document. So once you review the document, cyber insurance coverage and other things, right, with the cyber, your attorneys, that will really help actually, to
yeah, I think we should, Steve, I think there are a couple of questions one from Leo and Carl. Do you want to allow them?
Yes, I think we have time to get in another question. We do have additional questions. We know it's a hot topic and that we might have more than we can get through, even here extending. But we'll promise that you'll follow up on those questions. So let's hit one more question, and that is from the audience. What AI-based cybersecurity appliance do you recommend?
So I will actually there is no particular AI-based you can actually you try to do your POC first, right? Proof of concept, and then you try to actually put your business use cases, whether it is working in actually one particular vendor, large language models, or the other large language models, and then you look at the licensing cost and then how actually you can able to it's a basically there are multiple open sources, and then there are on top of that there is a AI framework. So I would recommend actually you try to complete the POC first with a couple of them, and then you will come to know actually which one you can choose and move forward. Lena, you want to add and delete?
No, I think, look, AI-based ransomware protection is relatively new in the industry. I think, China say, every organization is different. First of all, there's like one size fit all. You have to really run a POC to see what works, what doesn't work. And this is really a collaborative effort, right? I don't think there is no AI vendor they can claim that, hey, we have a solution, you just take it and plug it and play, you're going to be all protected. I just don't think anything exists like it. This is a collaborative effort. You have to work with your AI vendor to see where you can leverage and augment the solution.
Yeah, I think my quick comment, as well said, Dilip. Having a 93% or 95% accuracy is not enough. You want the patients to be alive, right? Yeah. So just relying on AI to do everything, I think it's going to be all assisted AI, whether they'll be assisting physicians or assisting different devices and equipments. And I think AI will play a big role in research and diagnosis and some areas of treatment. We're already hearing a lot of things around robotic surgeries and stuff. But if you go even 1% wrong, that's not good for healthcare. So I totally agree with you. We're not ready for, unless you have a risk mitigation plan, you go with very, very least sensitive applications before you apply AI. And even if you have a big cybersecurity policy recovery plan in place, do your own, analysis and groundwork for these use cases, ideal use cases before you deploy. Okay, go ahead, Steve. There's a last question.
Do you want the one more? Okay, this will be the last one then. How to effectively manage identity across various cloud platforms, how to manage authentication and authorization effectively with less hassle on the end user.
Okay, it's a very good question. So the question is actually how to effectively manage identity in cloud. So yeah, I think actually our traditional model to have a centralized identity system and then actually you authenticate from there, right? But in the evolving trend, actually different divisions, different departments, they have actually different identity systems. So you can federate those and then actually you can manage identity. So there are other products today. What you can do actually you authenticate in your centralized identity system, but authorization can happen in Azure based on your Intune policy or your MDM policy, whatever, right? So you can have actually a group authorization. You just authenticate and then send the authentication actually your name ID, everything to the other IDP. The IDP can actually receive your group membership and then actually from there it can authorize. Okay, so you can have authentication in one place and authorization in another place. You can actually, there are products today currently in the market. You can actually evaluate those. So that will help you actually to have a multiple identities and how to actually separate authentication and authentication, and again come back the control to actually clear it for MFA. So
yeah, just one comment for that. I've heard the CXOs of health systems really talking about people, the bad people impersonating IDs and logging onto public cloud. So so I think whether it's whatever type of public cloud provider, you have an on-prem AD or LDAP, then you go to the cloud, you want to make sure that it's the same identities that you are really allowing access to your systems and applications. So that's one area that I think as a best practice, you need to have a proper a technical plan in place to tackle and mitigate those risks. With that, I think from my end, I really want to thank Dilip Nath, the CIO, Deputy CIO of Sony Hospital, and Chinna Subramaniam, from the city of San Francisco. Thank you for joining me on this panel. And people who were unable to ask questions, or you asked questions and you didn't get answers, please feel free to reach out offline. We'll be happy to chat in detail. And go ahead, Steve. And thanks again.
Well, first, we would love to thank all three of you for sharing your deep expertise on an issue of a major issue of concern across healthcare. We're grateful for all the information that you shared today. We're grateful to Healthcare Triangle for pairing with us here at Digital Health Insights to bring everyone this webinar. And we would love to thank the audience for joining us and for asking some great questions. And once again, to remind everyone, this webinar will be available on demand shortly for you to view it from beginning to end. Thank you so much, everyone. This concludes the webinar.
Thank you.
Thank you,
Bye-bye.
Steve, for inviting.
Thank you.
Thank you.